CHRIAS or for yours?
It's asking for payment. Okay, I processed it. Only one went.
I think CHRIAS one.
So I start. Different.
CHRIAS is still alive.
So I'm going to stop and do it again.
CHRIAS is up again.
So is it a different link that it's?
It should be the same one pushed forward for yours, like the reuse.
Okay, it just happened, I believe. All right, I believe we are on. There was a couple minute delay from YouTube. Sorry about that. We are back after a couple of weeks break with our live events from Bariatric side as well as the UMACO. But we are going to be back on the regular weekly schedule. Today is April 9th. My name is Kemal Erkan. I'm the chairman of American Surgery Center as well as United Medical ACO. And I have Dr. Isaias Irgau with me. And Dr. Irgau, please introduce yourself.
Thank you, Kemal. Hello, everybody. My name is Dr. Irgau. I am the president of CHRIAS, Christiana Institute of Advanced Surgery, as well as the medical director of the bariatric surgery program at the American Surgery Center. My specialty is bariatric surgery, which is weight loss surgery, and I've been performing bariatric surgery now for almost 20 years. With my colleagues at CHRIAS, we are by far the most experienced group when it comes to bariatric surgery in our area. In fact, we've really started, set up, and established centers of excellence for bariatric surgery in many of the main health centers in our area, including more recently at the American Surgery Center, which is one of the few ambulatory surgery centers that has the designation of Center of Excellence for Bariatric Surgery in this country.
Thank you, Dr. Irgau. So I do want to introduce our other surgeons as well. So Dr. Isaias Irgau as the president of our group, and Dr. Gail Lynn, Dr. Michael Peters, Dr. Rose Singh, and Dr. George Ibrahim. They're on the bariatric side. And then we do have a colorectal surgeon, Dr. Sachin Vaid. He joined us in 2015, and our surgical PA is Sydney. So we do have a team of nutritionists with us, Amy, Beth, and Fran. They are specialized in bariatric, mainly work with our bariatric patients. And now what makes our surgery center unique is there are about 9,300 surgery centers around the United States, nationwide. And there are only 10 of them have the Bariatric Center of Excellence, which is the MBSA QIP accreditation. So we obtained that in our first year. And other than that, we also got Blue Distinction Plus recognition from Highmark, as well as Aetna Institute of Quality. And these are kind of indicators of our quality. when we do something differently than what people used to do, getting these certifications is actually not easy in a new setting. And we have accomplished this in our surgery center, which is the home for our bariatric patients, and then starting a healthier life after they leave our surgery center. And we are extremely proud of this. What we want to discuss today is we call these live sessions bariatric surgery journey. Now, the journey I think it's appropriate for this because the time that you start from your primary care to the time that you are done with your surgery and after surgery care, there are a lot of stuff that patient has to go through, but we want this to be, understanding this, we want this to be seamless and most effortless for our patients. So we have different teams built in our system, in our program, that helps our patients to go through this without any difficulty. Now, unfortunately, in the setting of bariatric specialty surgery, it's treated slightly differently, not slightly actually, it's treated very differently. It's almost like designed by insurance companies. It's almost designed to make the surgery more difficult. Although this is not a complicated surgery, the way that public actually perception and the insurance companies' enforcements is like, you shouldn't be getting it. That's actually, it's a big, huge mistake. And then we are actually working to change this perception because it's not true. Now, it's not true because we do about 300 cases in our surgery center, and except one in the last 12 months, all the patients were discharged on the same day. So 8 hours after the surgery is the recovery time for 90% of our patients. There are cases that patients are discharged in 6 hours window as well. And because we are at the most advanced level of taking care of those patients from the time of the process that we start and time of the surgery and what we do with the surgery, and of course, having most expertise surgeons in our team, that makes it a lot easier. However, now I want to actually approach this one a little bit different today. So we have COVID-19 pandemic, and it's almost a little over a year that we completed. And as soon as our first reaction was, all the elective cases, they should be postponed, right? So then we were part of that for 5 weeks, but then we did our homework and quickly realized that this is not realized necessarily, but quickly overcome the panic and say, look, we have to treat our patients with chronic problems. So, Dr. Irgau, I'm going to ask you if you can kind of walk us through with some of these patients, what they normally deal with. And then there is a new study that just came out from ASMBS, and I do want you to kind of explain that to us. So what's the typical bariatric patient for us, if you can just look at it from the COVID-19 risk factors?
Absolutely, absolutely. So essentially, bariatric surgery or weight loss surgery is currently by far the most effective treatment that we have available for the treatment of severe obesity or morbid obesity, which is defined as a weight which is at least 100 pounds higher than the ideal body weight, which means that if a person, for instance, is about 5'5" in height, and their ideal body weight would be probably about 150 pounds. If that person were to gain weight and their weight now is 250 pounds, which is 100 pounds above that ideal body weight, that is the definition of severe obesity or morbid obesity. And that definition also is important, not just because of the extent of the weight gain, but also because we know that certain serious disease start to develop once we approach that level of weight gain. And those diseases are listed on the slide. As you can see, they include things like type 2 diabetes, high blood pressure, heart disease, and sleep apnea. Now, if we want to address those diseases, we can address them by treating them one by one and let them progress, right? And the person will have these diseases chronically. On the other hand, we can address the weight with weight loss surgery, get rid of the weight, and also either get rid or improve those medical conditions as well. Now, if we go back to the issue of the COVID-19 pandemic, what we have learned very quickly as we were learning about this new pandemic is that there were a group of people who suffered more severe illness with COVID-19. And we know that advanced age was one of them, and we realized that very quickly. But another thing that came up very quickly is that people who had obesity also were at high risk for a serious illness if they were exposed to COVID-19. People who had obesity also happened to have type 2 diabetes, high blood pressure, or very important risk factors for severe illness if a person were to contract COVID-19. So when it came to COVID-19 and people started talking about slowing down elective surgeries so there would be more room to treat patients with COVID-19, there was an issue came up as to which surgery should be put on the back burner. And very often, many hospitals, they said, well, obesity surgery, bariatric surgery certainly should wait, just like plastic surgery. This is really a complete misunderstanding on the importance of bariatric surgery as a treatment method for the very people who are at the highest risk when it comes to COVID-19. And that's the argument we made very successfully, saying that we indeed have to treat patients with severe obesity whilst this pandemic is in place, because they are the ones who are going to suffer the highest consequences. And so bariatric surgery, instead of being in the back end, should be really at the front end of the procedures that need to be opened up and need to have space to be performed so that patients can start losing weight and get rid of this risk factor. And remember, with bariatric surgery, particularly early on in the first 2-3 months, people lose a lot of weight very fast. So we can reduce their risk of severe illness very quickly after bariatric surgery because of the effectiveness of these procedures.
So, Dr. Irgau, I think this would be time for us to share this diagram, this study actually. Just kind of, if you can walk us through this, because I think what we have done initially in the beginning of pandemic, this is a good study that supports what supports our position from that time. But this just came out, I believe, in January 2021. So let me actually just bring that up. So what do we see here?
So this is actually a very interesting study, Kemal. What essentially they are telling us, look, in this study, what they have done is they have taken two groups of people, okay? Both of them have one thing in common. Both of them have a history of morbid obesity, okay? But one group of people actually had bariatric surgery. So they started losing weight. The other group of people are still morbidly obese. They did not get that effective treatment. And what they looked at is they said, what happens if each one of these two groups is exposed to COVID-19? What is their risk of getting severe illness, getting admitted to the hospital, getting admitted to the intensive care unit because of the severity of COVID-19? What is the risk of them requiring artificial ventilation, respiratory support if they get COVID-19? What is the risk of them actually dying from COVID-19, right? So they compare these two groups. So one group is a group of morbidly obese patients who had bariatric surgery. The other group is a group of morbidly obese patients, but who didn't have bariatric surgery. And surprise, surprise, when you compare the risk of hospital admission, for instance, you can see that the group that had bariatric surgery had an 18% chance of getting admitted to hospital, whereas the group that did not have bariatric surgery had a more than double risk of being admitted to hospital at 42%. Let's look now at admission to the intensive care unit. You can see that the group that had bariatric surgery had no risk of being admitted to the intensive care unit. They were not sick enough to be admitted to the intensive care unit. 0%, right? When you had 13% of the ones who still had morbid obesity and who did not have bariatric surgery admitted to ICU. The same when it comes to requiring artificial ventilation, the respirator, right? None of the patients who had bariatric surgery required that, whereas up to 6.7% of the ones who didn't have bariatric surgery required artificial ventilation. And most importantly, when we look at this very important criteria, which is ultimately the most important, that is mortality, there was a 2.4% mortality in the ones who still had morbid obesity because they didn't have bariatric surgery. And of course, there was zero mortality, zero deaths in the group that had bariatric surgery. So this really was a study that validated what we knew. And that is, if you have morbid obesity and have bariatric surgery, you are protected from severe illness if you are exposed to COVID-19, as opposed to being a person who's still waiting to have bariatric surgery. So the argument that we successfully made that our patients should have priority access to the operating room when it comes to opening up operating room for procedures was a valid one. Not only we are accelerating their liberation from the weight and from those diseases, but also we're helping protect them from serious disease if they were to be affected by COVID-19.
Sure. Dr. Irgau, I do want to share another graph. This is a real patient. Of course, the name is not there. Now, one of our daily discipline, part of our program is we do case conferences daily. In the case conference, we have our care coordinators, care managers, facility managers, our surgeons, our nutritionists, myself, and our practice administrator from CHRIAS. So usually about like 10 to 12 people every day. So what we do is we go through cases, upcoming cases. So, and every once in a while, I'm the person who actually closes the cases if the patient is not going to continue. So they report back to us, and then we say, okay, if they are going to close, if they don't want to continue, we close. What is heartbreaking for me is seeing a delay. What actually, when we have new care managers, Dr. Guy, I don't know if I mentioned this to you, because you used to do this with me all the time, like just to kind of emphasize, delaying is at this level of BMI is getting it to a higher level of BMI a year from now or 2 years from now. And then I do want to share, this was kind of interesting, just recent, and then I have several other patients similar to these situations. But if you look at this graph here, this is a patient in July 2018. They were about 230 pounds. And right now, as of January, they are at 310 pounds. So we could have done the surgery here, here, and here, and it didn't happen. And that actually is extremely, extremely sad for patients. For that, like now they're going to go through the surgery now. Now, my plan was not actually using this one for this session, but when we sometimes have to support our ideas, our opinions with data, which it's kind of like my habit. And when I saw this, I'm like, okay, our nurses, here's why we want no delay, and we want to make sure that patients go through. And that's why we build what we have today, so that our drop rate actually is a lot lower than other programs. It's important to understand that patient is the center of our program. So we are not, every patient, regardless of their insurance, is being treated like a VIP. So
absolutely. Actually, Kemal, if you don't mind, I would like you to put that slide back up. This is an extremely important slide. There was a time in the past where even primary care doctors really did not refer patients in time for bariatric surgery, right? And I do remember when you and I went to a conference in Austin, Texas, many years ago, Dr. Kaplan, who is a leading expert on obesity in this country from Boston, made a remark that made an impression on you, right? He said, how is it possible that a patient would come back to see their primary care doctor year after year with a body mass index of 40, then 42, then 44, then 46, and there is no referral for bariatric surgery? How could you really see this patient year after year and they are gaining weight in front of you to really staggering levels and no referral is made to bariatric surgery, right? That was an important remark that I remember made really an impact on you also as we were looking into reinforcing our bariatric program. Well, what that tells us is something really important that is very often not mentioned enough, and that is when people reach a certain level of obesity, it becomes a lot easier for them to gain weight really in an exponential fashion, right? In other words, obesity itself becomes a better platform for worsening obesity. In other words, if you weigh 180 pounds, right? It is a lot harder for you to gain 10 pounds compared to a person who weighs 280 pounds. The person who weighs 280 pounds can gain that 10 pounds much more quickly with very, very little slippage, right? In other words, the more obese a person is, the more accelerated their weight gain becomes. And therefore, when there is somebody who is at that level of weight, Kemal, they are going through the program and yet then they withdraw and they don't go through. When we see them eventually a year later, we don't see them at the same weight. We see them at a much, much higher weight. And that is, so delaying bariatric surgery in those settings really sets the person for even a much worse course during that delay period.
So Dr. Galik, this is another patient, but situation was similar. This patient first tried in 2016, didn't go through the process, but now we did the surgery in January 2020. 9 months later, they are from BMI 50.3 to 38. So that's about 321 pounds to 239. That's 82 pounds almost, right? Yep. So this is kind of like what's been seen. And this is why we are emphasizing this issue of when you are at a morbidly obese level, your best chance is to take the action as quickly as possible. Mm-hmm. And the surgery can be the only option, only viable option. I mean, I'm not saying that you won't be able to lose weight, but it's going to be a lot harder and a delay is going to cause more problems. So the reason we have the multidisciplinary approach is to make sure that all the risk factors are being considered by our surgical team. And then, of course, the last thing that we want to do is put someone's life in jeopardy. So that's why we have this process of going through the selection process and making sure that all the medical indicators are being met. So like your lab results, your cardiology clearance, pulmonary clearance, psych clearance, and nutrition support. And then it becomes a pretty seamless process after that. So we are, as I mentioned earlier, we are going to actually have our bariatric live events on Friday from now on at 1 p.m. There may be some changes time to time based on our schedule, but we'll be back on the weekly events as Friday. Dr. Would you like to add anything before we sign out?
Yes, absolutely. So what we are essentially reiterating, Kemal, is that morbid obesity has a cost, right? And the cost is the quality of life is poor, but more importantly, the impact of the illnesses that come with morbid obesity is devastating, right? Type 2 diabetes, high blood pressure, sleep apnea, and many other illnesses. And as we are saying, currently, the most effective treatment we have is bariatric surgery. And fortunately now, we have bariatric surgery performed within the setting of centers of excellence with very, very high quality programs like ours, where the safety level for bariatric surgery is extremely high. At the same time, though, we cannot forget the fact that bariatric surgery, although effective, is not a magic answer. It is important, very important for people to realize that commitment to a significant change in the way one lives their life is important in terms of how they eat, in terms of how active they are, in terms of how focused they are on their nutrition. And all those, and that focus is going to be provided through the education and follow-up that we have in programs like ours. So bariatric surgery, the most effective treatment, but still not a magic answer. So it is important that patients show commitment to want to change, show that they are trying and they have tried to address the weight issue in their lives. These are important criteria for successful outcome for bariatric surgery in the long term.
Dr. Well, I do want to give an example from what was happening with my own weight issues. So just because we don't have morbid obesity doesn't mean that we are not dealing with the challenges of diet and exercise and all the other stuff. Sometimes it's just like different ways that we are utilizing different tools. Now, because of pandemic, there are less activities. I was one of those people who followed the rules, so I was between my office and home, and with on some personal side, there were some restrictions on the walking. So I didn't realize how little I was moving. So when I do FaceTime with my family, I use the camera angle better than they do. So if you don't have the right angle, you look bigger on the camera. So, and I look at them and look, okay, so everyone is gaining weight. So Kemal, it's okay if you gain 20 pounds. And then when I got there, this is 3 weeks ago, everyone looks so skinny. So the camera really did add 10, 20 pounds to them. But with my, camera angle, so I didn't actually see that. And I'm like, oh my God, like, how come you guys didn't, gain any weight? Well, what I see is like the way that we push ourselves to do activities, looking into what we eat. And then I do want to make sure that you actually utilize certain tools. Your phone is there every day with you, and you should keep it with you so you can actually see. Because what I had to do is, what was the reason for me? Like my BMI probably right now is about 28, 29. And since I got back from Turkey, from the time that I went there and then come back, it's 11 pounds net. And this averaging is 2,200 steps a day. This is my weekly. And then since I got there, and then 2,200 is for a pretty long time. So my first week in Turkey is 9,200 steps. So now once we knew that was working, then I didn't stop there. And then as you can see, like this week, I'm already averaging 6,500. And even like yesterday when I was home office most of the day, I got 6,500 steps. Because I'm now realizing, okay, here's what I have to do. I have to move because I don't eat much. I know that I don't eat much because we are on the intermittent diet. And what is really happening, my problem was not moving enough. And I quickly fixed that. Now, why I'm sharing this is because our patients, they feel like they are the victim of this disease. And they have to make these changes day to day in their life forever. But that's not the case. We do this, everyone does this. Unless you are like Tanner at age 24, and then, he's skinny, fine. But it's going to change if he doesn't follow the healthy life style. So we all go through this. But in some part of the population, it's at a higher level. So this is where the surgery helps. So, and that's why you have to really look into what's the best viable solution for you. And then remember that we are here to make this at a minimum risk, so then you are safely back to your life and actually healthier and happier life, hopefully. Well,
on that note, Kemal, I just want to add one more thing. I know we're getting short on the time. So first of all, it's important, as you absolutely showed now, to show people that walking is a very underestimated form of exercise. In fact, regular walking, about 30 to 40 minutes a day, or getting to anywhere above 5,000 steps a day actually helps greatly in enhancing our metabolism. So that should really, particularly in times of the year when the weather is so good, I think walking by itself is a great way for us to move. And now with the pandemic, where access to the gym is much less, that is something we have available, and doing it day after day is extremely helpful. Now, granted, there are some people, and Tanner may be one of them, Kemal, that are lucky enough to have a biology or a genetic makeup that really they don't gain too much weight. But on the other extreme, you have people who do everything they can, and yet weight gain happens so much more easily for them. You know, they could be drinking water and they gain weight, or they work hard to exercise and they gain weight. Clearly, the biology is a driving force, right? And that's why we're saying we need to really influence that by bringing surgery as an important tool. But at the end of the day, as you correctly said, all of us need to make fundamental changes in how we live for us to be able to stay healthy, you know, for the rest of our lives.
Absolutely. Well, Dr. Erkan, thank you for joining me, and we'll be back next week. Until then, please stay